what you were sharing with me before with respect to these mRNA products that have come out.
Okay. Well, when the pandemic first started, I guess I will put it that way, every piece of data that I looked at was extraordinarily suspicious.
Yeah.
And I did not at all believe the public narrative because it didn't make any kind of sense. So I'll use an example, right? We can speak with facts that can be validated publicly. One of those being is that 6 weeks after it was declared that there was a pandemic, the first human trial on the mRNA vaccine started. Now, vaccine development takes about 20 years. So to get through FDA drug process can take years. And first, of course, you have to get an IRB approved study. You have to do your animal testing and so on and so forth. So how in 6 weeks was an mRNA vaccine developed for treating COVID? How was the genome analyzed that quickly? How did they do their animal testing and get that approval through FDA and get that through? Can't happen, right? So right from the beginning, none of this made sense. And then when you actually looked at some of the early vaccine data, it was showing to be completely toxic.
Yeah.
And what we know today is the vaccine, we were lied to, right? So let's be very clear, is that we were told the vaccine would stop transmission and improve people's resistance to the virus. And we know both of those things are absolutely false.
Yeah.
So what we were told now, undisputed that was false. So what we did was we did 2 studies. We did first an investigational study with 15 people. Then we did a follow-up study with 60 people. And what we found in 100% of the cases where people took the mRNA vaccines, that after 4 months of their first injection, and it's supposed to be 2 weeks is where the washout occurs. After 4 months, they still had elevated levels of inflammation, specifically fibrinogen. They had elevated white blood cell count, meaning that the body was detecting that there was still an infection, and the white blood cells had mutated. And when the shape of cells in the body changes, that means their function is impaired. So not only was the immune system in a hyperactive state, which will eventually wear it out, the immune cells can't do the job that they're supposed to be doing. So the vaccine is actually weakening the immune system. Fortunately, we found, as validated by other studies, that if people elevate their glutathione levels, new study data showing that the enzyme bromelain will help to dissolve the spike protein, and some compelling data from Japan is showing that nattokinase will also dissolve the spike protein. So the good news out of all this is that if people were vaccinated, they can use supplements like NAC, bromelain, nattokinase to get rid of the spike protein, and they should probably do some other things like ozone therapy and IV vitamin C for at least a month to clear out any residual spike protein.
Yeah, and do the work to start questioning why you were bamboozled to receive the product in the first place. Start undoing that whole thing and really reevaluate the steps that you're taking with respect to your own health. But yeah,
and the narrative is a good thing in this case. Like when we were told to go inside and they closed the beaches in California, and it's revealed that 85% of the people dying from COVID have low levels of vitamin D. You have to really start to question, are they stupid, or do they know that there's this connection between vitamin D and COVID? But in all cases, the simplest thing for people to do to reduce their risk of mortality would be to be outside every day getting sunlight so they can elevate their vitamin D.
Outside in nature. And the other one that I've shared this over and over again on this show is the second strongest risk factor for death, according to a study published by the CDC, was fear/anxiety related disorders, which sort of should lead one to ask, given that their own data indicated that, why would they have kept us in a perpetual state of fear and anxiety throughout this entire charade? So it's really interesting.
I'll tell you the other one that I really laughed at, actually, is, we were told this was a respiratory disease right from the beginning. And so Dr. Fauci would say, well, don't smoke because that's going to increase your risk of mortality. A later study came out that showed that nicotine, tobacco, was totally toxic to COVID, and people that were smokers had a way lower risk, like 97% reduction in getting COVID. So ironically, smokers are better than most of the population.
You know what's funny on that? So I was a captain in the Army, and it was like a running joke, at the least in my unit, if not throughout the whole Army, that the best runners in the Army were the dudes who chain smoked. It always blew my mind. I was like, this doesn't make any sense whatsoever, but whatever. I don't know. I don't condone condone smoking. Maybe if it's
Oh.
organic tobacco, but I
Well,
don't
I've seen
whatsoever. But
right.
whatever. I don't know. I don't condone smoking. Maybe if it's
Oh.
organic tobacco, but I don't
Well,
know.
I've seen some studies now actually that show that tobacco is an incredibly powerful aromatase inhibitor. And, the whole smoking after sex thing apparently elevates men's testosterone levels.
Wow. Yeah. Yeah.
So there you go.
Well, a good friend of mine, Aaron Apke, is like, he swears by smoking cigars to elevate testosterone. So it makes sense. I do smoke organic tobacco occasionally. I mean, you think Native Americans used it ceremonially all the time, never had any issues. So it sort of should lead you to ask, okay, is there something else inside the modern tobacco products that we use that is leading to these issues? And it's not the tobacco itself that's a problem. But
I think that's fair. It's probably the pesticides and the herbicides in the tobacco that's the toxic part, right? So if you could get organic tobacco and grow it and dry it yourself, yeah, it probably has, like cannabis, right? Probably has some therapeutic benefits.
Absolutely. Okay, I want to be respectful of your time, David. So let's move into a couple questions. Is that okay?
Yeah, sure.
Okay, awesome. So the first one is from James. Have any experiments been done on reversing myopia or other vision-related issues?
We haven't done any specific studies with this. We have a whole host of anecdotal information. What I would recommend is that people with myopia, they study the Bates method. And this is a method of relaxing the eyes to improve vision. I can tell you anecdotally, I have a fellow in Malaysia and Singapore that I've known for many years who applied the carnosine patches on the forehead. So if you go from the center of the eye and then up above each one, so carnosine on above each eye at night, that in 30 days he was able to get rid of his glasses. So that's purely anecdotal, and we've never done a study, but I've known many people that have done that with great results.
Awesome. Amazing.
Yeah. Just anecdotal.
Anecdotal, but if there's enough anecdotal evidence, it tends to,
it would warrant a study.
Exactly.
I'd say that. Yeah.
Exactly. Okay. This one from Alex. What patch would be recommended overall for paint/joint and inflammation reduction?
So many things that can be done here. That I'd say the go-to patch on this would be Eon, and that could be paired with X39. Could also be paired with glutathione. Any number. I would also recommend supplementing with NAC to make sure that you're keeping your glutathione levels elevated. Natural products like curcumin and DMSO are fantastic. Olive oil. Olive oil is a phenomenal source. If it's real organic olive oil, monounsaturated fats are very powerful anti-inflammatory. So, a nice program of natural materials could be put together to completely eliminate joint pain.
Awesome. I'm glad you mentioned DMSO there because DMSO is one of my favorite things to use. So that's awesome. Yep. Okay, I think that's all the questions that we have. Let me just scroll through the comments real quick. Most people are just commenting